We'll let you qualify everything we've been saying para umpisahan ka agad natin. When you say we're now reconciling the data and this is leading to the higher numbers we're seeing now, what does this all mean?
Well, as we have always mentioned, no, we started reconciling data so that we can have improved numbers. Our main objective is for us to have accurate, timely, and complete data. So we started coordinating well with the local government units, strengthening our regional offices as well. So this line list that we get and the imputations that we have done, we were able to get all of these recoveries in a matter of this week we have worked on it. So if you remember last May 15, I think that was we started imputing these recoveries and we were able to add an additional 4,000 recoveries last June 15. And this was also the process that we have undertaken right now. So pag tinignan ho natin yung mga kaso natin sa ngayon, pag tinignan ho natin yung classifications nila, we only have around less than 2% of these severe and critical cases. And then the rest would be mild and asymptomatic cases. And mild and asymptomatic cases are supposed to recover after 2 weeks of being isolated or being managed. So we started, the main gap there would be that LGUs and the reporting units are not reporting the outcomes of patients. So naipon po ng naipon through the months, and when we are starting to clean our database, so we started identifying these individuals without outcomes, and we removed all deaths and the severe and the critical, and we were left with this number which have already passed that 14 days of isolation kung titignan po natin, and we imputed it statistically and we got these numbers.
Okay, now ma'am, just to manage expectations, kasi yung mga tao, lalo na tomorrow, magugulat na, 4,000 yung nadagdag. And we're gonna help to explain na hindi kasi nagsalita ng numbers. Pero ito po reconciliation ng numbers, one time, big time ba po ito? Or do we expect these numbers, these levels of cases to be at this level moving forward?
Oh, well, if you try to look at our numbers, if we talk about recoveries, we only have now 22,327 active cases, meaning these people, most of them would also still be mild and asymptomatic. So this process will be undertaken every 15 days so that we won't miss out on these individuals that are supposed to be tagged as recovered already but are missed out by the reporting units.
Okay, so meron din po kayo nung under the new IATF guidelines, DOH's recommendation is for time-based reckoning. Pakipaliwanag nga po yun, ano pong nagbago dun sa reckoning ninyo ng mga kaso under the time-based?
Yes, actually, Lucy, when we started analyzing our data and looking at the different implementation of our reporting units, we have noted that there are a lot of misinterpretation of our policies and the protocols that we have. Some of our reporting units would be tagging people or individuals who are positive after 21 days, after 28 days. Some people would only tag them after they have undertaken or undergone additional 14 days from the 14 days that they have been isolated from the hospital maybe or at home. So it takes 28 days before they can tag it as recovered. And this is not in line with the protocol that we have with the guidelines. So that's one challenge. Yes, another challenge would be that, as I've said a while ago, reporting units are not reporting the outcomes of these individuals. That's why nag-backlog po tayo at hindi po nalalagyan. So we had a lot of numbers without outcomes. So we had to do statistical imputation so that we will be able to complete this data. So kung makikita po natin ngayon, yung 22,000 na natitira, makikita ho natin almost siguro po mga 90+% of those would be mild and asymptomatic, and we will be continuing with this process every 15 days.
Yes, but what's so when we reckon a person infected to be recovered on the 14th day,
Yes, specifically in our department memorandum that we have issued, it states there that if you are an asymptomatic, confirmed positive individual, after 14 days of being isolated, if you did not have or did not develop any symptoms at all for that period of time, you will be tagged as recovered after the 14th day. If you are symptomatic and you are classified as mild, from the onset of illness, if you are already asymptomatic without symptoms already, and the doctors would give you that clearance, you just need to finish the 14 days from the onset of illness. So 14 days din po ang bibilangin at
Nawala.
Yeah.
Hmm.
Okay.
Okay.
Pero paano pag, okay. Pero
Ah.
yung paano pag sinipon ka on the 10th day? How would you reckon that?
again, Lucy, if you are still
What if you
symptomatic at,
develop
on
a cold or a cough on the 10th day? How would you reckon
then
that?
you can Yes, then you cannot be tagged as recovered. So kailangan nga po naming linisin ng ganito, no, na bine-verify pa ho yan doon sa line list natin. So when a person is not cleared by their physician as being as clinically recovered, and then they won't be tagged as recovered. Meron po tayong criteria, the clinical recovery and the isolation period. So the clinical recovery, kailangan ma-assess ka ng physician, masasabi ng physician you are already recovered clinically, and then dapat nakumpleto mo rin yung 14 days mo. These are the two major criteria for a person to be tagged as recovered.
But how do you monitor the ones at home? How do you know that they're going to be truthful and they will say, oh, wala naman akong symptoms during the 14 days? How do you find out?
Yes, Lucy, the assumption would be that the BHERTs, they are mandated to monitor these persons at home doing home quarantine, and they would need to report. This person at home cannot go out of their house and cannot reintegrate until they can be given clearance by the municipal health officers or the city health officers. So they would still see this person because this person cannot, as I've said, they cannot reintegrate into the community unless they get their clearances from their health offices.
Hindi na sila in-test.
No retest anymore. No, the criteria right now, because of the evidence which has been published, no, I think that was 3 weeks ago, where WHO and even USCDC has signified, no, or has mentioned that on the 10th day that a person, positive individual, on the 10th day, they are already non-infectious. So therefore, you don't need to test that person anymore. If and when this person will be tested and turns out to be positive again, or still positive, that is just because the RT-PCR machine is very sensitive, but it doesn't tell you if the person is infectious or not. But experts already are saying on the 10th day, you are non-infectious anymore.